Allergy. An exposure of an animal to an antigen produces a state of increased reactivity of the animal's tissues to that antigen causes a state of specific immune response, and a state of hypersensitivity is said to exist, which is clinically recognizable as allergy. Allergen. A substance that cause an allergic reaction. E.g. house dust mites, pollens of trees, grasses and weeds, molds, or food-induced atopic substance. Difference B/W allergen and antigen. Allergen antigen. Definition: an allergen is a special type of antigen which causes an IgE antibody response. An antigen is a substance that can trigger an immune response, resulting in production of an antibody as part of the body's defense against infection and disease. Nature and examples: allergens are non-parasitic agents like dust, pollen, pet dander, or certain chemical substance in food or water. Antigens can be either chemical substances, proteins, glycoproteins, etc., or pathogens, bacteria and viruses. Treatments: not very complex, more complex. Disorders/diseases: allergen can lead to certain disorders like itchiness, urticaria, dermatitis, edema, asthma, etc. Antigen can lead to bacterial and viral diseases, autoimmune diseases. Types of allergic, hypersensitivity, reactions. 4 major mechanisms for the induction of a hypersensitivity response. 1. Systemic anaphylactic shock, type I, 2. Autoimmune hemolytic anemia, type 2, 3. The local arthus reaction, type 3, 4. Type 4 hypersensitivity is caused by the induction of sensitized T lymphocytes and thus has a cell-mediated mechanism. Allergy testing. 2 principal methods. 1. Intradermal testing. 2. ELISA testing. Percutaneous. Place a drop of allergen extract on the skin, after which a lancet is used to lightly scratch the skin. The skin is evaluated after 15 to 20 minutes for presence and size of cutaneous Wheal. Intradermal testing. Method of choice for many specialists. Appreciated because of high specificity. However, corticosteroids adversely affect reactivity of the skin. Sedation before testing. Animal must be shaved. No standardized criteria are used for interpretation of reactions. Detects presence of specific IgE antibodies, functional ability for cutaneous mast cells to degranulate upon exposure to allergens. Wheal formation. RAST, radioallergosorbent test. Levels of allergen-specific IgE in blood sample. Advantage over the intradermal test. There is no clipping, no sedating, no potential to have an adverse reaction to an allergen injected into the skin. Less chance that prior drug therapy, e.g. cortisone, will influence the outcome. Can be used in patients that have dermatitis. RAST, radioallergosorbent test. Disadvantages. False positives are more common when compared to the intradermal test. Routine blood panels. On occasion, a specific type of white blood cell called an eosinophil is elevated in allergic conditions. Other conditions, notably worms, can also cause this elevation in eosinophils. A routine blood panel can also give an indication of internal or hormonal problems that might show up as a skin condition, e.g. hypothyroidism and Cushing's disease. Skin prick test. Lateral thorax skin clipped and cleaned with 70% isopropyl alcohol. The test sites were marked with a 2 cm separation between sites and a 5 cm separation between the histamine and control solution. Allergens placed on each designated site. A lancet and a small 1 mm pricker was used for inoculating each allergen and discarded afterwards. Skin pricked at a 45 angle. Skin prick test. 10 mg/ml dihydrochloride glycerinated histamine base applied as a positive control. 50% glycerol saline solution used as a negative control. Results: positive, diameter of the Wheal equivalent to or 3 mm. Skin prick test. ELISA testing. Measures the amount of allergen-specific IgE antibodies in serum. No shaving or sedation required. Ideal for patients with unhealthy skin. However, not standardized results are offered. The quality of detection reagents is a key factor. Detection of only IgE antibodies and not IgG or IgM. Difference B/W intradermal and ELISA technique. Intradermal ELISA invasive system, shaving and sedation can be required. Simple blood sample. It cannot be performed in the case of skin diseases. Simple blood sample. Suspension of the corticosteroid and/or antihistamine treatments for a long period. Suspension of the corticosteroid and/or antihistamine treatments is not required. Possibility of anaphylactic shock no possibility. Skin intradermal test. Methodologies: dogs in lateral recumbency with sedation, e.g. midazolamidine. Area approximately 15 x 15 cm over the lateral trunk is clipped. Injection sites are marked. 0.05 ml of each of a panel of allergens is injected into the dermis with histamine as positive control, saline as negative controls. Injection sites are examined 15 minutes later for immediate reaction, and at 24 to 48 hours for delayed reaction. Skin intradermal test, CONT. Validity: sensitivity 66 to 90%. A positive intradermal skin test animal has skin sensitizing antibody. Does not necessarily mean that the allergen is clinically significant in that animal. Skin intradermal test, CONT. Technique: intrinsic, limitations. False positives may occur if very irritable, inflamed or traumatized test site, E.G. with pyoderma. False negatives, if drug interference, inherent host factors, E.G. serious internal disease. Technician: extrinsic, limitations. Poor skin test technique may give false negative or false positive results. Irritant allergens may give false positive results. Insufficient allergenic principle, e.g. outdated extract, may give false negative results. Skin intradermal test, CONT. Errors and artifacts: drug interference, E.G. antihistamines, glucocorticoids. Irritable, inflamed or traumatized skin. Stress, pregnancy and serious internal disease. Testing at the wrong time of year. Poor skin test technique. Outdated extract. Food allergy testing, serological test. To check hypersensitivity to a specific food. Sampling source of test material: venous blood sample. Quantity of test material: 2 ml whole blood or 1 ml serum. Quality control: sample storage: separate serum before sending. Sample transport: sent by first class post to ensure next day delivery to laboratory. Package according to postal regulations. Tests: methodologies: ELISA test for IgE and IgG specific to a panel of foodstuffs common in the canine diet. For IgE, the tests are semi-quantitative and are presented as standardized scores. For IgG, values 95% of the normal reference range are reported as positive with a class score. Skin, Fleabite hypersensitivity. Intradermal skin test positive to flea antigen. Check at 15 to 30 minutes and again at 1 to 2 days for delayed reactions. Caution: most commercially available flea extracts contain very little flea saliva, and as a result, many false negative results are seen. This shows skin sensitizing antibody or cellular reactivity, not clinical hypersensitivity, so may produce false positives. Serology. SNAP ELISA test, ELISA based on detection of IgE. Will miss dogs with delayed reaction only. Positive SNAP result does not co-form allergy, only previous exposure to flea bites. Sampling source of test material: venous blood sample. Quantity of test material: 4 ml whole blood or 2 ml serum. Quality control: sample storage, ideally separate serum before sending. Sample transport: sent by first class post or courier to ensure next day delivery to laboratory.